Hello, thanks for stopping by to this 2021 Medicare Advantage Clarity presentation. I'm going to provide some clear answers to you to your Medicare questions. This is me. My name is Tom Basie. I provided my phone number and email address. Aparte yo hablo español, I've noted there. If you have any questions after this presentation, please consider reaching out to me via email or phone. It's good to be with you today. Here's my agenda, what we're going to talk about today. I want to talk a little bit about understanding your Medicare choices. We'll discuss eligibility and enrollment for Medicare. This says the advantages of Medicare Advantage plans. Actually, there's some nice, compelling statistics about Medicare Advantage here in the U.S. in 2020. I will have a significant information about prescription drug coverage. That's a point of confusion for people, and I have some nice, clear tables to help understand that. I will have some specific 2021 Medicare Advantage plan information. I want to discuss a little bit about Agent Assistant, how I can help you. Talk about some additional resources that can be made available. And then finally, I want to remark about United Healthcare, why you should consider them as someone to be your carrier for your Medicare journey. So here we go. This is Medicare in a nutshell, a red, white, and blue card. It comes from the federal government. It has your name, a unique number that has both numbers and letters in it, and then the effectivity dates for Part A and Part B. Part A, it covers hospital and inpatient care. Part B pays doctors' visits and things that are not in the hospital. In 2020, the deductible for Medicare Part A was just over $1,400, and it was just under $200 for Part B. Now, for most people, the Part B premium costs around $145 in 2020. So that's Medicare at the high level. It comes from the federal government, and that's what it covers. Now, having said that, typically people will choose option one or option two as something to supplement their Medicare coverage. That is two things about Medicare. Number one, it doesn't have an out-of-pocket maximum. And number two, it doesn't include drug coverage. So some people get a Medicare supplement insurance and then they add a drug plan. Medicare supplement coverages do not have drug plans, so they'll get those two things. Their monthly premiums on both of those. Medicare supplement can have very thorough coverage, very little out-of-pocket premiums, but it can be rather expensive. Medicare Advantage option two is an alternative. It does have drug plan and coverage included in it. And it also has some additional benefits like potentially some dental coverage, some vision coverage, maybe hearing aid coverage. Often the premiums on this are quite low, but there are copays. It's just important to understand which of these two options. For my discussion of today, I'll be talking predominantly about Advantage plans. Option one is Medicare Supplement, option two is Advantage plans. Okay. Having said that, to get involved in Medicare, typically you're 65 years old. There are some exceptions. If you're under 65, you can qualify perhaps on a disability, other special situation. But typically we're talking about 65 years old. In addition, we're typically talking about U.S. citizens, or you can be a legal resident who lived in the U.S. for at least 5 consecutive years. So at a high level, that's what we're talking about for Medicare. Now, having said that, initial enrollment period, 3 months before your 65th birthday and or 3 months afterwards and or the birthday month, you can enroll in those Medicare Part A's and Part B's that we discussed. You can also pick an Advantage plan, sometimes called Part C, or the drug plan kind of shown underneath the option one for the Medicare supplement. So a 7-month window around your birthday to do that. I would remark that there is a penalty for drug coverage. They want you to get something. So you're incentivized to do so. If you wait and do not sign up for something that has drug coverage, either a standalone drug plan or an Advantage plan, if you don't do that, then when you do it a year later, well, you're going to pay 1% of the average monthly premium for each month you delay. So I'm a proponent of signing up for that. Even if you don't currently take drugs, I think it's something to consider to avoid that penalty. Now, every year, there's an annual enrollment period, October 15th to December 7th, that you can add, drop, or switch Medicare coverage. There's actually a second enrollment that many people don't know about. It's the whole first quarter of the following year, January and through March. You can make a one-time change as well. So even if you already have a Medicare Advantage plan, you can make a change, you can add a drop or change it in this, and you can do a one-time change in this time. So there are plenty of times during the year when you can make a change to an Advantage plan or your Medicare coverage. Having said that, there are also some special enrollment periods. Anytime during the year, if these occurs, then you also have the option to make a change. If you retire and no longer have employer coverage, that's a special enrollment period. You can enroll then at that time. If you move out of a service plans area, if you've already got a Medicare Advantage plan, then you move. Those plans are typically network, zip code, county based. And so if you move, you won't have coverage. So that's a special enrollment period as well. 2 other periods are if you qualify for extra help. Extra help is a federally funded financial assistance program. So if you hit hard times and you get qualified for that, there's also a special enrollment period there. And then finally, if you get a diagnosis, certain chronic conditions, I think diabetes and or chronic heart disease might be examples of that. If you get a chronic condition, then there's a special enrollment at that time of diagnosis. So those are anytime during the year you can do that as well. So my message is there are many times potentially where you can change and or add or enroll in Medicare Advantage plans. Now these are just, it says the advantages of Medicare Advantage, and they are, but really what I contend is these are just three compelling statistics kind of making the case for an Advantage plan. As of 2020, there were over 24 million people that had Advantage plans in the US. Of those, 93% of them reported satisfaction with those plans. And the reason is likely because typically they spend on average 25% less than with just original or Medicare. So those are three compelling reasons I think it's something to consider an Advantage plan. A lot of people have them, they're quite satisfied with them, and they save significant monies with those. Having said that, this is a nice side-by-side comparison of original Medicare and a Medicare Advantage plan. Coverage for hospital stays, if you recall, that's Part A. They both cover that. Coverage from medical care like doctor visits, they both have that. That's Part B. Similarly, preventive services like flu shots, they have that. Now, what original Medicare does not have, that Advantage plan does. Now, there's just asterisks here because it varies plan to plan, but there is prescription drug coverage that original Medicare doesn't have. There's potentially some routine and vision coverage that original Medicare doesn't have. There might be actually even some dental as well in some plans, and then a limit to your out-of-pocket cost. I said that once already, but I'll reiterate. There's no limit to that on original Medicare. If you sign up for an Advantage plan, at least it will be $4,000, $5,000, whatever the number is, there'll be a limit to your out-of-pocket costs. So that's a side-by-side comparison of Advantage plan and original Medicare. Okay, this top 10 list is not necessarily in order of importance or anything, but these are 10 things that I just want to make certain that I mention. Even if I've said them once, I'm going to say it again to emphasize. Number one, you must continue to pay your Part B premium. As I remarked in 2020, that was around $145 per month for most people. You do need to keep paying for that, even if you sign up for Advantage plan that costs $0 a premium per month, and there are plenty that are like that. It is $0 premium for the Advantage plan, but you do have to keep paying Medicare Part B. Medicare Advantage has you covered. It's got the stuff that original Medicare does, so you can just use your Medicare card. Oh, sorry here. Joining Medicare Advantage may affect your current coverage. So if you're working and then you're switching out, or perhaps if you're a veteran, there's times when you already have coverage. It's important that you understand which plan you select because you want it to work. You want them to play nicely. If you're leaving work, ideally, if you're going to a Medicare plan, you're saving money per month. Otherwise, maybe you need to say you decide if you're going to stay with work or not. But understand the premiums and the cost and the benefit of that. And then if you're a veteran, you can actually get some of these benefits. Maybe you want doctors and dentists near you, don't want to go to the VA. You can sign up for an Advantage plan, but maybe you want to keep taking your drugs from your veterans TRICARE VA benefit. So select a plan that coordinates and works with it. So it's important to consider both your current coverage and then the Medicare transition. It's best to use network providers. We don't use the word best hardly at all in Medicare world, but we do it there because simply by definition, in-network providers are going to cost less. Some plans will allow you to go out of network, but it's going to cost more. So it's best to use network providers. You may qualify for financial assistance. You can either do it at the federal level, as I remarked about extra help, or at the state level, there's Medicaid. If you apply for those, there's implications. And in fact, there are some Advantage plans that are even have richer benefits than a regular Advantage plan if you qualify, for example, for a state program. If you're Medicaid and Medicare dual eligible, there's some very robust plans available specifically to help those people. Okay, I got 5 more here. I mentioned this once, but I'll say it again. If you enroll in Part D, think of D as in drug. If you enroll in that late, you may pay a penalty. So that's why I'm a proponent of signing up for some kind of drug coverage, even if you're not taking drugs, to avoid that penalty. Medicare supplement plan, sometimes called a Medigap policy, is not a Medicare Advantage plan. That's my option 1, option 2 slide I showed you earlier. They're different. Remember that Medicare supplement doesn't have drug coverage, so you want to get a drug plan as well if you did that. Medicare Advantage plan has it included. Keep your member ID card handy. That is, you needn't carry around that red, white, and blue Medicare card if you get an Advantage plan. You can take that to the doctor, take it to the pharmacy. If you've got dental and vision visits, take it to the dentist, the optometrist. You carry that card around to take advantage of all the features it has. You can leave the Medicare card at home. Medicare Advantage offers the same protections as Medicare. I'll reiterate, I showed that side by side of the two, has everything it's got and then some. And then you have a built-in financial safety net. The last one on that side by side is the thing about out-of-pocket max. There is no out-of-pocket max on original Medicare. An Advantage plan will have some. It varies plan to plan, but it'll say $3,000, $4,000, $5,000, some number where you know your care will not exceed that because the plan will pay once you've had that total cost out of pocket. Okay, I'm going to spend about 3 or 4 slides, maybe more, on drug coverage because it is a point of confusion for people. I think this slide alone clarifies some things nicely. So people ask me all the time, you know, I've got the same medication or group of medications and I go to the same pharmacy. Why does it cost different amounts during the year? This chart nicely explains that. There's 4 stages, and these are defined by the federal government, and all the plans adhere to this. This is what happens. There's an annual deductible stage. There's the initial coverage. There's the coverage gap, and then catastrophic coverage stage. Depending on which stage you are in there, the amount you pay varies. So annual deductible, as the plan, as the word implies, in kind of industry standard, deductible is what you pay before the plan kicks in. So if you have a $100 retail value pharmacy bill, and you have a $300 deductible, well, then for the first 3 months, you're going to pay 100% of that. The plan pays nothing because it's a deductible. Now, it varies plan by plan. Some plans have a different number. Some have no deductible. But if you have one, you pay that amount until the full amount, if you will. There's no plan coverage until you meet the deductible. Now, these next 3 stages, I'm going to make up an example. Let's say your retail costs are $1,000 a month. You've got that. And let's say your plan and initial coverage, let's say there is no deductibles in this instance. Initial coverage, let's say the copay is based on the list of medications, either that one expensive medication or your list. Let's say it's $100 only. Well, then for months 1, 2, 3, and 4, for example, you're going to pay the copay and the plan pays the rest. So $1,000 worth of cost each month, boom, boom, boom. Each month you only pay $100 because you're in initial coverage phase. You move into the coverage gap, also known as a donut hole, after your costs exceed this. So we're in month 5, for example. Your drug costs exceeded $4,130, and you were paying $100 a month. Well, now you're going to pay 25%. I on purpose selected $1,000 to make the calculation easy. That means now instead of paying $100 a month, you're now paying $250 a month. You're not paying just the copay. You're paying 25% of the cost, and you'll do that for several more months until your out-of-pocket costs exceed this. So not until month 7 or 8 will you be on the other side and you'll drop into catastrophic. When you drop into catastrophic, you only pay a small copay or maybe 5%, whichever is greater. And again, I picked that $1,000 to make it easy. It's $50. So for my hypothetical example, for a few months, you pay $100 copay. Then once you exceeded the amount that, and it's defined by the government, then you pay 25% of that, or $250. And then it drops down once you've exceeded that number, say month 8 or 9 or so. And then you'll pay only 5% or $50. So that's why for a single medication, at the same pharmacy, you're paying different amounts potentially. Now, if you have 0 deductible and very low premiums, you may just stay in initial coverage all the time. Maybe you just pay $4 for one low-cost medication. That's it, whatever it is. But this is why your costs vary. I've got a few more slides about prescription drug coverage to help your understanding. Total drug cost versus out-of-pocket. I was remarking that total drug cost is what the drug cost. It doesn't include the premium, but what the drugs cost. And that's what was used to determine what phase we're in. And if you recall, I used the $1,000 cost example. So that even though my copay might have been $100 or 250 different times, the total cost of $1,000, and that's what determined what was in there. The out-of-pocket drug cost was what I was paying. If I paid the deductible, if I paid the copay, if I'm paying 25% of the things I'm paying. Now, it doesn't include my premium, but that's out-of-pocket. So that's just a difference to understand between the two. A few more. Whoops. So one thing, pharmacy network. In United Healthcare, there are over 65,000 pharmacies in the network, but not every single pharmacy in the U.S. is in there. So my message is, it is likely there's a pharmacy near you that is in network, and you will save on prescriptions if you go to one of those in network. You could, if you have a plan that allows out a network option, you can go to that another carrier. Perhaps sometimes they have different levels of preferred, but bottom line is you're going to save if you go to in-network retailers, per previous remarks. There's also often mail order delivery. So you can potentially save either by going to in-network retailers or using mail-in. And this is both convenient, safe, and cost-effective. I can't guarantee 100% of the time it'll save money. Every once in a while, I've seen examples where it's cheaper to get it straight from the retailer, but it's something to consider. But use in-network networks and use mail-order pharmacy. A couple more things I want to share with you about drug coverage. The drug list is called a formulary. Every plan has a formulary. It doesn't have every single drug in the world in it, but it has an exhaustive list of the drugs that they cover. And when they do that, they give them tiers. Tier 1 through Tier 5. Tier 1 is preferred generic. Tier 2 is generic drugs. Tier 3 is preferred brand name drugs. Tier 4 is non-preferred drugs. And Tier 5 is specialty. And I suspect you might guess the cost or the copay that one has to pay goes up as the tier value comes up. Some Tier 1s, actually, sometimes there's a $0 copay. So if you only have a Tier 1 drug and there's a $0 copay, it won't cost you anything. and you won't get to the coverage gap. Or conversely, specialty drugs can be multi-$100 per month, sometimes even on the copay, and so they're just expensive. So that's what happened. Every plan has a formulary, and every drug on there is on tier 1 through 5. A couple more things, just a few more things here. Step therapy is when you try to use a lower cost medication first to treat something, and then step up to the high one if it isn't effective. Quantity limits, as the name applies, it's sometimes the amount per month or the quantity of pills can be made available are limited. And then prior authorization is when a physician has to authorize that the drug is being used correctly. So those are some verbiage, because the reason I say all this is because you can get exceptions to the formulary list. That is, if your drug isn't on there, or if there's a quantity limit or something, if it's not on the drug list, you can request a formulary exception. If you need the utilization of the quantity limits to be, if we need to exceed those, you can get a utilization exception. In either instance, if the doctor submits an exception request for you, generally it'll take 72 hours to get the decision back, and it can be expedited if the doctor believes your health requires it. So that's kind of my discussion on drug plan. Now, what I'm going to do at this point, I'm going to show you 4 plans side by side. They're Advantage plans, and they happen to be in the North Texas area. But I would contend, even if you live in another part of Texas or in another state, there are going to be similar plans that work similarly. So I think the takeaway is to look at these 4 plans, understand the different features of them, notice how they differ, and think about how, if you're making a selection on a Medicare plan, which of these are important to you. Different ones are different for everybody. So here are the 4 plans that I got side by side. This is called Plan 1 and Plan 2. This one's called Advantage and Choice. If you'll notice, the first 3 are HMO plans. This last one is a PPO plan. HMO means you have to go in network. If you go out of network, there is no coverage for that. So these require you to go in network to get care. The PPO, you have the option to go out of network. Plan 1 and Plan 2 have been around for many years in the area. These other plans are kind of newer plans, so sometimes I'll make that distinction. This plan called Advantage is actually kind of just a reformulation of Plan 1. They're quite similar, so I'll point out the differerences. In certain ways, they're quite similar. In certain ways, there are differences. There's certain features that I think they determined that the market maybe wanted some things versus others, so you can choose one or the other of these. They're similar in certain ways, different in others. Plan 2 is the only one where there's actually a premium. You actually pay a monthly premium. The other 3 are a $0 premium. And what happens is you do that on purpose, and what happens is you're driving up the benefit amounts or driving down the copays. So I'm going to step through these line by line. Where they're similar, I'm just going to go right past it and remark it. Then I'll show you the differences between them. So we got 4 plans, 3 HMO plans, and 1 PPO plan, and 1 with a paid premium. So here we go. The premium, like I say, is $0 for all 3 of these except for Plan 2. The annual medical deductible is $0 on all these. Primary care provider visit is $0. They're quite similar so far. Specialist visit is where you see the first distinction. It's not that big, but then again, if you go to a specialist lot, maybe this becomes more important to you. The one where you're paying a premium actually has the lowest copay of $20. The one where you have the flexibility of going out of network has the highest copay of $35. It's only $15 difference, but if you go multiple times in a year, maybe that becomes more important. Specialist refer or require. Yes, yes, yes for the 3 HMOs, no for the PPO. So not only does it allow you to go out of network, it allows you the flexibility to go to the specialist without referral. Again, it's going to be at kind of cost. You'll typically have lower benefits or higher copays for certain things. Preventative service is $0 copay for all 4 of the plans. Here's the first significant difference between these, and this is inpatient hospital. If you go, a hospital stay is going to cost you a different amount across these different plans. The one where you pay the premium is actually the lowest. It's a single $150 copay. Plan 1 costs $275 a day, 4 days 1 through 5. Then after that, it's a $0 copay. So then the 2 newer plans actually cost you more per day, $325 instead of $275, and it's actually a day longer too before you that you have to pay. So each of these costs $325 a day, and it's 4 days 1 through 6, and then it goes to $0 copay. So notice already you've seen a significant difference in these plans for the cost of a hospital stay. Skilled nursing, interestingly, the daily price, for one thing, they're all $0 copay for skilled nursing facility for days 1 through 20. Once you get past that, the price is the same, $184 per day, but the number of days you have to pay that copay is the way it varies. So the plan where you're paying the premium, you only go to day 38. Between 21 and 38 there's a copay of that $184. Plan 1, you actually go to day 42. And remember, I said the Advantage plan was similar to Plan 1. It's also day 42. The PPO, where you have the flexibility, it goes all the way to 57. So you're starting to see the trend here. This one has the highest benefits and or the lowest cost, and this one, conversely, this one has the most flexibility but has the higher cost. Outpatient surgery numbers, it's 0 up to a maximum of, and these just reflect the same numbers as the daily rate in a hospital stay. That is, maximum for this one is $150 for the one where you're paying premium. It's $275 for plan 1, and for these newer plans, it's $325 maximum. Diabetes monitoring supply and home health care have a $0 copay for all 4 of these plans. So I've got 2 or 3 more slides like this, but I think you're already understanding how they vary, and hopefully you're getting a feel for what the different services these plans, because they all offer some nice coverage. But it's good to see how they vary plan to plan. Okay, radiology, diagnostic radiology for the older plans, it's $125 maximum. It does get a little higher for the newer plans, $150 copay. For diagnostic test procedures, similarly, $20 copay for diagnostic testing, $25 copay for the newer plans. Lab services is $0 copay for all of them. And then outpatient x-rays is $0 copay for all 3 of the HMOs. There is a $15 copay for the PPO. Ambulance is the same for all these. Whether you do ground or air, it's a $250 copay for all of them. Emergency care, similar, it's a $90 copay for all of them. Urgent care, there's a slight difference. They're all $40 copays, whether it's contracted or not. Actually, there is a slight advantage for the PPOs. There's a possibility if you go to a contracted urgent care place, only $30 copay. Now, here's the biggest financial difference, the total out-of-pocket max that I talked about previously. The one where you're paying a premium has $3,200 out-of-pocket max. Plan 1 and the new variation of Plan 1, the Advantage plan, their out-of-pocket is $3,900 out-of-pocket max. It's actually up to $6,700 for a PPO plan. So that's the most significant financial difference. Got a couple more things to share with you. Those are all kind of associated with Medicare anyway. Here's a little remark on drug coverage. I'm not going to read through this whole thing for you, but what I would remark is Tier 1 if coverage, kind of the lowest cost ones. Well, believe it or not, 2 of these plans have a $0 copay, the one you're paying and the new one. So in other words, the new version of Plan 1 has $0 copay as long as you're in Tier 1. It's actually a $2 copay in Plan 1. It has a $3 copay for the PPO. So that kind of is following the same trend. And then we talked about deductibles. These 3 HMO plans have a $0 deductible for drugs. For the Advantage plan, the $0 only applies to Tier 1 and Tier 2. There actually is a $345 deductible for Tiers 3, 4, and 5. So that's, I think, reflects, again, kind of a trend. You're starting to understand how these different plans compare and contrast. Now, this is above and beyond, extra benefits above Medicare. We talked about that, what Medicare doesn't have. And so these are some things that these plans offer that Medicare doesn't have. $500 for covered dental services, commonly used exams. That's Plan 1. Actually, for the Plan 2, where you're paying a premium, and for the new version of Plan 1, it goes up to $1,000, and then it's actually back down to $500 for the PPO. So there's some either $500 or $1,000 of basic dental service included in all 4 of these plans. Routine vision care, actually, it's a $0 copay for 1 routine eye exam every 2 years for all of these plans, and it's actually $100 allowance for some eyewear, with the exception of the plan where you're paying the premium. Actually, there's a $200 allowance instead of $100. So you get more. So that's the thing. You get more for this plan if you pay that monthly premium. Routine hearing coverage. The older plans had routine hearing coverage in it. There's a $0 copay for an exam. And then there's actually some nice copays. They have Healthcare has a whole spectrum of hearing aid products, but you can get some low cost ones for $75. Conversely, there is no coverage on the newer plans. So in this market alone, you might pick Plan 1 versus the Advantage plan. Depends upon whether dental is more important to you or hearing aids. That's one of the fundamental differences between those 2 plans. Insulin savings is the same for all 4 of these plans. You can get a month of supply of insulin for $35 or less. Now, there's an over-the-counter benefit that counterintuitively is applied for all these plans except for the one where you're paying the premium. But for these 3, it says $160 per year. It's actually $40 a quarter, and you can order via phone or online $40 worth of over-the-counter. That is not prescription drug, but over-the-counter aspirin, antidigestive. You can even get some Band-Aids. And many things, there's a catalog, but many things you might get at the pharmacy, but the over-counter section, you can get those. So it's $40 quarter credit that they provide you. And then all 4 of these have a membership in Renew Active. And Renew Active, kind of like the pharmacy discussion, there are many, many that will accept that. And so it'll be a membership at no cost to you. I can't guarantee the gym next door to you will have that, but it's likely that there's one near you because many gyms will take this Renew Active and provide you a membership at no cost. Okay. I'm not going to read through this. This is the specifics on the plan numbers and what counties they're in. Bottom line, I'm telling you, those 4 plans are offered in North Texas. And if you don't live in North Texas, that's fine. They're plans, they're Advantage plans that operate like those near you, maybe slightly different benefit amounts, but now you've gone through those, you've got a nice feel, I think, for how the plans work, what they offer, and how they vary plan to plan. Okay, just a little bit on United Healthcare. They've got over 40 years serving the Medicare community. There are other carriers perhaps, but these guys have over 40 years. I don't know if anybody has more years taking care of Medicare Advantage than United Healthcare. They've got a lot of years. More people in the US use United Healthcare for their Medicare Advantage plans than any other. The members like and keep their Advantage plans. They take metrics all the time. You know, I kind of had that remark in there about 93% satisfaction. People keep a United Healthcare plan. And then finally, you have our promise and commitment to living a healthier and happier life. I'm familiar with this. I know they're dedicated to this. I represent United Healthcare sometimes in different grocery stores and pharmacies, standing around answering Medicare questions. So they really are committed. Having said that, there are some additional resources. We're on the home stretch now. These can be made available to you in a hard copy and or electronic over phone. Medicare Made Clear is very similar to this presentation, but it's a hardback book that United Healthcare puts out. Medicare Hotline, you can go to medicare.gov. You can call Medicare, and there are government employees to help you sign up for Part A and Part B. Medicare and You is a nice thick book that they often provide. I don't know if they did intentionally email it to every single person as they turn 65, but a lot of people get this from the federal government, Medicare and You, from CMS, which is the organization that administers Medicare plans. Online plan finders, that plan comparison, you can find stuff like that online and see them side by side sometimes. State resources, you can check eligibility, and you can even apply for Medicaid, which is a state-funded program. Social Security Administration, ssa.gov, or you can call them online. But what happens is if you're signing up for both simultaneously, if you're retiring and you're going to take Social Security and you're going to take Medicare, your Part B premium, for example, you can coordinate and you can have them take that Part B premium right out of your Social Security paycheck. So they're available to help you. Administration and Elder Care Locator. There are people and resources and online ways that we can help you find care, in-home care, even nursing homes, that kind of thing. Those are all kind of resources that are available to help. Having said that, I want to help. Let me help. I can help. I can help you look up your doctors, make sure that they take a plan if you're considering it. You give me a list of medications, and I can show you the different costs, even across the coverage gap, and then even at different retailers near you. Additional services, I can help you find a gym near you that will give you a no-cost membership if you've got one of these plans. I can help you navigate a little bit in, for example, a Medicaid journey. If you think you're available, if you've got financial assistance coming to you, I can help you find out about that. And then if you're a veteran, I mentioned you can potentially keep your VA benefits and your TRICARE. You can sign up for some of these plans, for example, that won't have drug coverage, so you continue to take advantage of drug coverage prices through your coverage, but you can get that gym membership, or you can go to a dentist and or a hearing aid stuff, something like that. You don't have coverage for near you instead of having to go all the way wherever your VA location is. So to reiterate, thanks very much for your time. This is me, Tom Basie. This is my phone number and email. Please do consider reaching out to me if I can be of any service. I'm grateful for your time. You have a good rest of your day.